Evening all. We are live, and I am trying something new tonight. I've had a couple of. It's been quite an eventful evening. I am trying to do this on LinkedIn. Yeah, is it possible for this guy to have more exposure? Well, you know, sky's the limit, and I did something on LinkedIn, and it said, "Do you want to create an event?" And I've created an event. I do it on my laptop here, but. And the event's supposed to be happening now, but I don't really know how to make it like link it. I think I've done it wrong. So if anyone out there is on LinkedIn wondering when the event is, look, I can see my blanket in the background there. Let's get that on board because it is freezing. So can you see my? Oh, I haven't sorted out the background. Oh, I haven't sorted out the background, have I? No, God, sorry. Right, so I can't do anything on LinkedIn, quite frankly. I don't know how to. So I created an event. It says happening now. One attendee, that's me. How do you do an event on LinkedIn? Anyway, it amazes me in this day and age how there is such a lack of instruction books. I mean, stuff like TikTok and all that sort of stuff, there's no instructions whatsoever. Never mind that, when you buy an iPhone, there's no instructions. And certainly there's no instructions for this. It said create an audio event. I said, yes, please. Does anyone know how to do it? But in fact, okay, we're gonna walk away from this because I am going to ignore that, and I am going to just carry on regardless. Video to a video on LinkedIn. View event. Be the first to react. Okay. So the other thing that's happened tonight is that my tripod broke. Actually broke last week, and a little bit of plastic cracked on it. I have actually fixed it, and with Gorilla Glue. Yeah, I'm mentioning the make. And I've just turned it, and it's completely broken. Look at that. Can you see that? Completely broken again. And I actually left it for days. But that, as soon as I turn the knob, that has just cracked again. And that cost me £8, that Gorilla Glue. So I wasn't messing about. I was getting the good stuff. And it has completely cracked again. And you know what? I've actually just bought some more Gorilla Glue today, some wood Gorilla Glue. Because that's all they have. There's all these brands, isn't it? These big brands stifle the competition. Because I don't know, is Gorilla Glue, have I done it wrong? Maybe I've done it wrong. Oh my God, someone's phoning me. God. Someone's phoning me. What happens when they phone during life? It just shows how infrequently people phone me. But anyway, oh, what's going on? Are you back? So anyway, the is it? What's happening? Oh God. The tripod's broken. So Facebook, and YouTube, I'm like that. Instagram, I'm like that, which isn't so good, is it? Because the tripod's broken. The other thing I was going to say is last week on Facebook, I have reason to believe people were commenting and I wasn't responding because nothing's coming up, because I'm actually not doing this on Facebook itself. I'm doing it on BeLive, which is like I don't know what you call it, a piece of software, I guess you'd call it. And none of the comments are coming up. So I don't know if anyone, I'm assuming no one's commenting on Facebook, but if you are and I'm ignoring you, it is because I can't see the comments. Comment assistant off. Post chat. I mean, I don't think I'm not going to do anything different. I just assume that. But there is things commenting on Instagram. Let's have a look. Megan said, hi, JJ. Hi, Megan. Nice to see you. Spow Pals, hi. Got your own little club. Hi, Samantha Van Aston. Was glitching. It was glitching, Spow Pals, because I got a phone call. So that hopefully it'll be steady now. I hope we're getting more phone calls. And I'm going to close Instagram down because I think we can safely say I don't know what I'm doing. But if anyone does know if you can do this sort of stuff on LinkedIn, then I'm just going to close out like that. So right, what we got? I'll tell you what we got. We've got some questions, and I'm going to ask those questions right now. And if you have got any questions, please ask them. If you're on Facebook and you're asking a question and I'm not answering, just going to apologize about that, because I think I'm actually seeing 0 comments there. So if there are comments, I don't know, I'll go into Facebook after this and I'll maybe type a response to your comment. I might have to just start going native Facebook, just not using this fancy software. The reason I use this fancy software is because it shows it on the screen like that, which you don't see on Instagram, and Instagram actually seems to work quite well. So is it worth it? I hear you ask. Who knows? I don't know. I quite like it. Anyway, is what it is. You can turn it into a crawler as well. What's a crawler? I'll show you what a crawler is. That's a crawler, yeah. So can you inject hyaluronic acid? I mean, sometimes these, I need a bit of context to these questions, because I'm not sure what the context to that is. Can you inject hyaluronic acid? Now, what does that mean? Does that mean, can I inject? Do I inject it? Or can hyaluronic acid be injected? So hyaluronic acid can be injected. It's quite common. It's a very common filler. So injection of hyaluronic acid is extremely common, and it can be injected. Yes, is the answer to can hyaluronic acid be injected. Can I inject it? Well, I suppose I could, but I don't. I don't inject it. I don't do fillers. So I don't inject it, but it can be injected. And it's a filler. It's a temporary filler. It lasts a few months, and it's for sort of wrinkles and fine lines and plumping stuff up. So it can be injected. If by some bizarre twist of fate, whoever's asked that question is out there and I've got the wrong end of the stick with that question, please put a comment in and let me know. But I hope that's answered the question, in that it can be injected, but I don't, just because I choose not to do non-surgical treatments, because I just do sort of surgical treatments, basically. Is this a weird angle on Instagram? Does it feel like I'm dominating? This is a dominating angle. Can I? Shouldn't have this live, should I? No, that's not going to work. Oh, how's that? How's that? Yes. Right. Look at that. So, do we offer? Is that better? Is that a better angle? Do we offer liposuction to remove a buffalo hump? I never have. I'll be honest with you, I never have done liposuction to a buffalo hump. So that's the starting place for the answer to this question. I mean, a buffalo hump, first of all, you've got to look at the posture. Is it due to poor posture, or is it literally due to fatty deposition, which you get often with steroid use? I mean, I guess it could be done if it is a fatty lump. The thing about this sort of stuff is you've always got to look for an underlying cause. So if it is due to steroids and you are still on steroids, I'd be a bit like, is it worth doing that? I'll tell you what, I can put Facebook on here. Let's see if there's any comments. Is it worth doing that? So I would be a bit concerned if it is due to a thing like that. But I've never done it, and again, I'd probably take advice from sort of an endocrinologist or whoever's giving you the steroid, assuming it's due to steroid, because I don't know if when you stop the steroid, it goes away. So if that's the case, maybe that's why I've never done it before. Maybe if it does go away when you stop the steroid, then there'd be no need to do it, and you wouldn't do it while you're on the steroid, because it would potentially come back again. So I'm now just on my other computer, on my laptop here, to see my own Facebook Live broadcast, to see if there's any actual comments on Facebook, and I don't know how to find it. How do you find it? I'll be honest. Oh, there's a comment on Facebook. It's come up. Laura J. Right, so it has. Is that right? Good. Thank you. Oh, there it is. There it is. Yes. One comment, one share. I've got a share on Facebook. I should say, please comment and share, shouldn't I? Hold on, it's a share me. It says Staiano plastic surgery. Oh, anyway, I've shared it myself. Okay. Well, I better close that because that'll confuse matters. Laura Jane Noto has commented, hi, it's not on your topics for this evening, but what are your thoughts on hip dip correction with fat transfer? Laura Jane Noto, I will talk about anything, so it doesn't have to be on my comments. Actually, have I finished this liposuction to remove a buffalo hump thing? So yeah, so I've never done it. Liposuction can remove areas of fat, which is what a buffalo hump is, as long as it's not posture related. So you don't need to sort out your posture first, and if there is an underlying cause, which there pretty much always is, I think, which is usually steroid, then you'd have to look at your endocrinologist to see if you could. If you're not going to stop the steroid or not going to stop the underlying problem, there's probably no point in treating it, because it would come back again. So that might be why I've never done it before. But maybe if I saw a patient with it, I would talk to an endocrinologist and get to the bottom of this and give you a more comprehensive answer to this question. Laura Jane Noto, it's not your topic to this evening, but what are your thoughts on hip dip correction with fat transfer? I shared to my WhatsApp group. You got a WhatsApp group? Wow. Oh, you share. You were the share. Oh, I thought I was a share. Oh, good. Thank you for sharing. Hip dip correction. Hip dip correction. Okay. With fat transfer. Okay. What's hip dip correction? Okay. Well, sometimes you can, sometimes you can't. Right. Hip dip. I'm assuming that's a dip in your hip. Is it, Laura Jane? What's hip dip, Laura Jane? Sorry. Forgive me. I don't know. Okay. So if you've got a dip in your hip, Laura Jane, then you could improve it with fat transfer. So fat transfer can improve a dip, and there's no reason to say that it couldn't improve a hip dip. Why not? Why not? So yeah, you can inject fat underneath the skin and fill dips. I don't know if hip dip is a thing. The way you're writing it suggests it's a thing. Is it some kind of thing after surgery or something, or is it a problem? So, but I mean, I guess it would depend on the size of the dip, because you are a little bit limited in terms of volume of fat grafting or fat transfer. So the fat transfer, so if it's a big dip, you might not be able to transfer enough fat, although people are doing quite big fat graftings, particularly with sort of buttock augmentation. That's a topic of its own, but but in general terms, if there is a dip in your body, fat grafting might be an option. The only question I would ask, Laura Jane, is the dip due to surgery? So if it's due to surgery and scarring, then I find that fat grafting is not as effective as you might like, because if you inject fat into the area where the scar is, it doesn't really push the scar up, and it goes either side of the scar and accentuates the dip. So if a hip dip is a surgery, due to some kind of surgery, then I would be concerned. But if it's just a thing which is not due to surgery, then fat graft, I would say, could well be an option for that. Yes, Thank you. Yes, my hips dip in. Okay. Yeah. I've got to be honest with you, Laura Jane. I would say that it's more common that the hips to dipping out is more of a common problem. Hips, and then liposuction is what you do for that. But dipping in, fat grafting, I've got to say maybe, Laura Jane. I'm not so sure about it. I'm not so sure. Maybe something I'll have to see and probably talk to you about. But maybe is the answer. Where are we at to here? Do we offer diastasis recti repair, endoscopic abdominoplasty? My wife told me off putting that. She saw me put these questions. She said no one's going to know what that is, but that is the question as asked. I didn't put these words in. That's what the person asked. So diastasis recti just means your recti muscles, your six-pack muscles, are a bit too far apart, and it's often when you've had when you need a tummy tuck, everything gets stretched, the skin gets stretched. That's why you need a tummy tuck, so the muscles get stretched. So you have a bulge between your muscles. So you usually have a bulge above your belly button when you're tense. So that's what diastasis recti is, a bulge above your belly button. So what this question is asking about now, I'm not sure about the term endoscopic abdominoplasty. I'm not sure. I mean, this is the question that the person has asked, but I don't understand what an endoscopic abdominoplasty is. Endoscopic surgery is keyhole surgery, telescopes. So you can do things like take your gallbladder out, take your appendix out through keyhole surgery, which is quite an advance in surgery. I can understand how you could do endoscopic diastasis repair. So that would be repairing that diastasis without making a big cut over the top of it. That would be, I can understand that. I don't offer that. That would be a general surgeon. I, as a plastic surgeon, don't do endoscopic surgery. Endoscopic surgery is minimally invasive surgery in order to access a body cavity, usually the bowel, but you can access the lung, just by putting tubes and telescopes in. And it's sort of more for bowel and lung surgeon as in other sorts of surgeons who access body cavities. So plastic surgeons don't tend to do endoscopic surgery. So an endoscopic diastasis recti repair would be a general surgeon, and it would be equivalent like a hernia repair. Now, and that I would imagine would be something that could be performed, although I wouldn't perform it, and it could be a good way of repairing a diastasis rectus. The only problem is that it doesn't remove any skin, because the whole point of minimally access surgery and endoscopic surgery is minimal scars in the skin. So I wouldn't call it an endoscopic abdominoplasty because it wouldn't be an abdominoplasty. You wouldn't be removing any skin. An abdominoplasty removes a big chunk of skin from your tummy. So an endoscopic abdominoplasty is what's the word when it's like not necessarily like almost pregnant, but like it doesn't go together. Non sequitur, in my view. I can't understand an endoscopic abdominoplasty. Abdominoplasty and most of the surgery that certainly in body contouring surgery involves removing large bits of skin and in giving large scars. So you can't do an endoscopic approach. You can't give a no scar approach to take a huge piece of skin out. You can do a no scar / minimal scar approach to repair the muscles, but as I say, that would be the general surgeon, but it wouldn't be an abdominoplasty, and we don't do it. So that would be a general surgeon. So if you've only got a diastasis rectus problem and you haven't got excess skin, then that might be something you want to consider. If you haven't got enough spare skin to do a tummy tuck, then you could look at an endoscopic repair. But usually the most common situation is everything stretched, the skin and the muscles. So usually it's in combination with a tummy tuck, and it's relatively easy to do it at the time of a tummy tuck because it's all exposed. So that's an interesting question, and yeah, that was a good one. Do we offer treatment for excess skin located in the armpit? Excess skin located in the armpit. So this is sort of thing you've got to think, what are they talking about? I think I know what they're talking about, and I think they're talking about something called accessory breast tissue. And when you put your arm down, you sometimes get a bulge here in your armpit, just in this sort of area over the bra line. Over the bra line. So that's accessory breast tissue. So I think that, again, if the person who's asked this question is out there and I've got that wrong, then please let me know. But that, I would imagine, is what they're on about. And yeah, we do. That is something, and it's often something that's important to point out to people if they have got it when they're having a breast reduction or something like that, because you don't really address it with a breast reduction, although you can address it extra. The way to address it would be, it's difficult to correct because the on paper it's skin and fatty tissue usually, but it's breast. There might be some breast tissue in it, and the best way to treat that will be to cut it out, because again, tightening the skin will cut it out. The problem is you don't want to get a scar, but especially symmetrical. Can you imagine symmetrical scars coming up into your chest? So if we are going to excise it, I try and keep the scar inside the armpit, so I don't make a scar here. But then that means I can't excise the skin here, which means that there might be a bit of baggy skin there. Or probably the other it's a difficult place for a scar because it's the armpit, hot and sweaty, etc. So the other option will be to do liposuction, smaller scars, minimally accessed, and that would not have the problem with wound healing in the armpit, but it wouldn't remove any of the skin. So once you've removed the fatty tissue, there might be some baggy skin there. So 6 and 2 3s, you pays your money, it takes your choice. Less scarring, less wound healing problems, but potentially a little bit of baggy skin. More scarring, more potential wound healing problems, less baggy skin. I would probably avoid doing a full scar onto the chest, because I think that doesn't look great if your scar extends onto the chest wall, onto the anterior chest wall, and then you can see the scar. I don't think that looks great personally, unless it'll be a really bad area of accessory breast tissue. So obviously tailor the treatment according to the individual. It's a bespoke service we offer, so you can't say something for everybody. We would have a look at you and assess you and do what is appropriate for your condition and talk to you about the pros and cons of doing it each way. Do we offer umbilical mesh removal? No. Simple answer. Difficult, really difficult. One of the problems with meshes, really, if you have a problem with, I mean, meshes are great, don't get me wrong, they do a good job, certainly with hernia repair, which presumably this is what that's talking about, because it's an umbilical mesh, so it's presumably an umbilical hernia repair. And they're really good because they integrate and they get scarred in, and they strengthen the abdominal wall, which is what they're supposed to do. The problem is, for the same reason, them getting integrated and scarring in means they're really hard to remove. Now, we wouldn't really put them in, so it would probably be a general surgeon who would put them in. And so because they're more into sort of hernia repairs, so they would also be the ones to take it out, unless it's just that we're doing a tummy tuck and there's some mesh there and it's just floating about. We might sort of trim it. But if you're specifically saying I want the mesh completely removed, then we wouldn't do that. A, it's difficult because it's so embedded and scarred in, and B, what the mesh is there for a reason, presumably to repair a hernia. So if then we remove the mesh, what are we going to do? Put another mesh in, or do some other way to repair the hernia? And again, whilst plastic surgeons, we can repair small hernias. Big hernias would be general surgeons. That's their expertise, really. So if there's a big hernia, which presumably it was to get an umbilical mesh in the first place, that's what will be going through my mind. What are we going to do if we do remove the mesh and there's a big defect in the abdominal wall that we've got to somehow repair? Do we put another mesh in? And then you might say, well, hold on a minute, I told you I don't want the mesh. And path to unhappiness, that, isn't it? So no one wants that. So yeah, I wouldn't get involved with removing an umbilical mesh. I would get the surgeons involved, ideally the surgeon to put it in, get an opinion from them, and either do a joint procedure or have the mesh removed and then have whatever you're having done with us. Or maybe that's just all you're having, the umbilical mesh removed, in which case, yeah, it would just be a general surgeon. So I'm out. I'll be honest with you. I am out of questions. If you have any questions, so Laura Jane, you're saying it's not on your topics for this evening. I don't have topics for the evening, Laura Jane. I just wing it. So if there's anything that comes up, to be honest with you, I prefer it when people ask questions and stuff, because then well, answer them, I suppose. So sorry, LinkedIn, that it didn't happen, but yeah, let's face it, they haven't missed anything, have they, really? I will be back same time next week. Will I? I don't know. Probably. October already, and you know what that means. November, December. Oh my, dark. Look at it, pitch black. Right. Anyway, wrap up warm, and I will see you same time, same place, right here next week. Facebook, YouTube, I'm checking out. I love you big time. You know that.